DA in Limpopo says it's worried that the health department is failing to fill vacant critical medical positions. Joining us now to talk about the situation is Risham Maharaj, DA Limpopo MPL. A very good afternoon to you, sir. Welcome to Daytime Update. So you have written, haven't you, laying out your concerns to the Limpopo Health MEC, Dr. Popi Ramathuba. Has she responded in any way?
Good afternoon to you and good afternoon to your viewers. We have written to the MEC regarding the situations, with the vacancies. We haven't had a responses yet. It's an issue that the Democratic Alliance has been raising for quite some time now, both within the House, the legislature, within the committees, as well as within the, written questions to the MEC. This is a challenge for us, and we feel that it's a crisis that is further exacerbating the poor medical situation and conditions in the Limpopo healthcare services.
And give us a clear idea of how that plays out. I mean, for example, Limpopo has medical negligence claims into the millions, and you believe that much of that is in fact linked to the fact that hospitals and other facilities are so short-staffed that exhausted workers are bound to make mistakes.
Well, absolutely. I mean, if you look at some of these vacancies, just to give you an indication, we have a 76.83% vacancy rate in specialists. That is 130 posts filled out of 561. In terms of medical officers, we've got a 54.57% vacancy rate. That's 1,307 posts that have been filled out of 2,877. And then if you look at professional nurses, we've got a 40.71% vacancy rate, where you've got 8,754 posts filled out of 14,765 posts. This clearly is a challenge, as the failure to fill these critical posts leads to overworking of the available staff, and it's no surprise that the department has a 15 billion rand contingent liability due to litigation. What it also has a situation of burnout of the staff. It has a situation where attrition levels of staff are very high in the province, because the staff migrate to urban areas due to the poor working conditions because of these high vacancy rates.
I remember a conversation that I had with the MEC, Popi Ramathuba. This was a few years ago when, I don't know if you recall, Risham, a set of medical students, these were nurses basically, who had been taken in, and then the department had said at the end of their time at hospitals in Limpopo, listen, we actually cannot afford to keep you at all because there's no money. And that has been the repeated message even in other parts of the country as well, where the provincial government say they simply cannot afford to hire as many people as they need. Is that really what's to blame for the level of the crisis in Limpopo?
Well, we must actually take things into perspective here. The situation in Limpopo is that the Department of Health is paying about 70% of its budget on salaries. Now, one has to ask the question, why do we pay 70% of the budget on salaries yet still have such high vacancy rates? And the correlation between this is that historically the department has been employing individuals at the maximum salary scale. And that has been a challenge where that has been eating into the budget. But clearly we cannot continue like this, because we are offering the people of Limpopo an inferior service levels in terms of health. And then we talk about the budgets. If we have situations like we've had where we've had the PPE scandal, we've had corruption within the Department of Health, we've got a situation where we pay Veritas Digital 1 million rand a day on scanning facilities. And one has to question, what is the priority of the Department of Health? Surely it should be on care for patients, and surely it should be about filling vacant positions that add directly to providing a superior healthcare service to the patients of the province.
I'm curious now about where you think the additional money should come from to be able to assist, because if there are already workers in post, even if their salaries take up the largest chunk of the costs for the department, they can't exactly be sacked because they're also needed. So what then needs to happen in terms of sourcing the additional funding?
Well, that's what we are writing to the MEC for. What are the plans in place? What is she thinking about? Because it's a situation that has been like that for many, many years. And we cannot constantly be told that there are plans in place, because whilst we have this situation, your litigation is increasing on the other hand, your contingent liabilities. And surely there's a disconnect between having high vacancy rates and also having high contingent liabilities. What we are saying is where critical positions must be filled, I think that there must be engagement between the Premier and the Treasury Department, and we've got to look at how we can facilitate this. You know, government is now looking at pushing the national health, the NHI. And by pushing the NHI with vacancy rates like this, can you just imagine the turmoil that will be created when we don't have people that are able to service the current situation that we have?
Would you accept that, Risham Maharaj, that the majority of this crisis is in fact a situation that is beyond the control of the Limpopo government officials?
I would say that a lot of this crisis is as a result of failure by government to act on corruption, to hold people accountable, for poor management of the department, and for neglect in filling these issues, these vacancies, when they could have done it, years ago, but have let the situation deteriorate to a situation that we find ourselves in currently.
Risham Mohammed, DA MPL in Limpopo. Thank you, sir.